Beth Abraham Hospital, the Bronx. Summer, 1969. A woman opens her eyes. She has not spoken in 43 years. Her body has been seated in the same ward chair since the year Calvin Coolidge was president. She is 64 years old. She speaks. Her voice carries the inflection of a generation that no longer exists. She asks about Gershwin. She hums a song from a dance hall that closed before the Second World War. When the doctor asks what year it is, she answers, 1926. She knows the date of Pearl Harbor. She knows Kennedy was shot. She has been recording the world from inside a body that would not move. None of it, she says, has felt real. This is her case file. Her name is Rose. She was 21 when it started, a sore throat, a low fever, a heaviness behind the eyes that did not lift. In the winter of 1926, Rose fell asleep, not the kind of sleep you wake from. She was one of the last victims of an epidemic that had been circling the world for a decade. It had no name when it started. By the time it had one, encephalitis, lethargica, inflammation of the brain that produces lethargy, it had already reached every continent. Between 1915 and 1927, the disease struck an estimated 1 million people worldwide. A third of them died in the acute phase. Of those who survived, the majority never fully recovered. Many were left frozen, rigid, mute, motionless, locked inside bodies that had simply stopped obeying. The medical world had never seen anything like it. And then, just as suddenly as it had appeared, it vanished. No cause was ever found, no cure was ever developed, and the patients it left behind were quietly forgotten. The epidemic began in the winter of 1915 in Romania. Early cases appeared among soldiers moving through the trenches of the First World War, though in the chaos of the front, no one connected them. By 1917, the disease had reached Vienna. Constantin von Economo, a neurologist, a pilot, and the first Austrian to hold an international aviation license, had recently returned from flying combat missions in South Tyrol to treat head injuries at the University of Vienna. He examined a cluster of patients who did not match any known diagnosis. They had arrived with labels: meningitis, multiple sclerosis, delirium, but none fit. What they shared was a profound, unshakable drowsiness. Von Economo presented his findings to the Vienna Psychiatric Society in April 1917. He named the condition Encephalitis lethargica. Within days, René Cruchet, a French physician treating soldiers at a military hospital, published a near-identical description. Neither man knew of the other's work. By 1919, the disease had spread across Europe, into the United States, Canada, Central America, and India. It peaked in 1920, and again in 1924. Some patients were stricken so suddenly they appeared to lose consciousness mid-sentence, food still unchewed in their mouths. The symptoms were not uniform. Some patients slept for weeks. Others developed the opposite, an unrelenting insomnia they could not control. Some suffered violent involuntary movements. Others became rigid. Children who survived often emerged with permanent personality changes. Von Economo classified the disease into 3 forms: the somnolent type, marked by overwhelming sleepiness and paralysis of the eye muscles; the hyperkinetic type, marked by insomnia and uncontrollable movement; and the amyostatic akinetic type, in which the body slowly locked into position. He described these patients as extinct volcanoes, motionless, speechless, and seemingly empty. But they were not empty. The disease had a second act. Months, years, sometimes decades after the initial infection, survivors began to develop postencephalitic Parkinsonism, a condition nearly identical to Parkinson's disease. Their limbs stiffened, tremors appeared, their faces became mask-like, and slowly, one by one, they stopped moving altogether. Institutions were opened across the world to house them. The Highlands Hospital in London, once a fever hospital covering 70 acres, was converted to hold 20,000 encephalitis lethargica patients. Beth Abraham Hospital in the Bronx, originally called the Home for Incurables, admitted its first cases in 1919. By the 1930s, the acute epidemic had vanished. No new cases, no explanation. The medical world, increasingly occupied by other crises, moved on. The patients remained. Rose was one of them. She had been admitted to Beth Abraham in 1926. For the next 43 years, she sat in the same ward, her body frozen in mid-gesture, her eyes open but unreachable. The staff fed her, they changed her position. They did not expect a response. Then, in 1966, a young British neurologist named Oliver Sacks arrived at Beth Abraham. He found 80 patients in states like Rose's, human beings who had not moved or spoken in decades. Sacks did not accept that they were beyond reach. When a new drug called L-Dopa, levodopa, a compound that restores dopamine levels in the brain, showed promise in treating Parkinson's disease, he decided to try it on the postencephalitic patients. In the summer of 1969, he administered the drug to Rose. She opened her eyes. She spoke. She sang songs from the 1920s. She moved her arms for the first time in 4 decades. For a few weeks, Rose was 21 again. The awakening did not last. Within weeks, L-Dopa's effects became unstable. Rose grew agitated. Her movements turned erratic. Too fast, too uncontrolled. The drug that had returned her to the world was now producing side effects as disabling as the disease itself. The dosage was adjusted, reduced, increased. Nothing held. Rose stopped responding. She returned to her frozen state. Other patients at Beth Abraham followed the same arc. A brief recovery, then a collapse back into silence. The reason was structural. Encephalitis, lethargica, attacks the substantia nigra, a region deep in the midbrain responsible for producing dopamine, the neurotransmitter that enables voluntary movement. When the substantia nigra is destroyed, the brain can no longer send the signals required to move. L-Dopa provided a synthetic replacement, temporarily restoring dopamine levels. But the damage was too extensive, and the brain could not regulate the influx. What caused the original destruction remained and remains unknown. The epidemic coincided with the 1918 influenza pandemic, and for decades the two were assumed to be connected. But the first encephalitis lethargica cases appeared in 1915, before the flu. Von Economo's first 13 patients showed no influenza symptoms, and in 2001, researchers used RT-PCR, a technique that detects genetic material in tissue samples, on preserved brain tissue from original victims and found no trace of influenza. The leading modern hypothesis points to autoimmunity. In 2004, Russell Dale and colleagues examined 20 patients with symptoms resembling encephalitis lethargica. 95% showed autoantibodies, immune proteins, targeting the basal ganglia, the brain region that governs movement and cognition. Half had developed the condition after a streptococcal throat infection. The theory, an immune response to a bacterial infection, misfires, crosses into the brain, and attacks its own tissue. More than 9,000 papers were published about encephalitis lethargica during the 1920s. The Matheson Commission was founded in 1927 with a pledge to find a cure within 2 years. It disbanded in 1940 without one. Oliver Sacks published Awakenings in 1973. The book described 20 case histories from Beth Abraham. It became one of the most widely read medical texts of the 20th century and was adapted into a 1990 film. The book reminded the world that the victims of Encephalitis lethargica were still alive. Many had been institutionalized for half a century, forgotten by families, by the medical establishment, and by the disease itself, which had stopped producing new cases but had never stopped punishing its old ones. Sporadic cases have continued to appear. In 2004, Dale's study identified 20 new patients in the United Kingdom, with symptoms matching the original descriptions. Whether these represent the same disease remains unresolved. The cause of the epidemic has never been identified. The mechanism of transmission was never established. There is no diagnostic test. There is no vaccine. If encephalitis lethargica returned tomorrow, medicine would be no better equipped to identify it than it was in 1917. 1 million people were infected. The world published 9,000 papers. The file remains open. Rose was asked, after she awoke, whether she understood what had happened to her. She said she did. She knew the years, she knew the presidents, she knew the wars. But 1926 was the last year that felt real. The disease took 43 years from her life. No one has ever explained why. One question for the comments. If a disease vanishes without explanation, and no one knows why it started, how do we prepare for the next one? The next case on this channel, 3,500 operations performed on patients who never asked for them, and no one checked the results. This is the sealed ward